I almost died. And it is my friend who told me. I called my friend and she said, you use garlic. I almost collapsed. It burns.
Now you're even lucky. I've seen people who use things like soda, omo, and they don't.
But
they don't just use it for infections. They even use it to prevent pregnancy. They get omo, mix. Never you are munda.
That's new to me. I've never heard of it.
Doctor. I told you
I used it before I came to this lecture. Before I started the lecture.
Okay.
Yes. I can no longer do self-treatment.
If I hear garlic.
Garlic almost killed me one day, doctor. You're still on garlic. There are some local medicine that can even burn you and you die. Now, there is we do waxing and normal shaving.
Yes.
Now, one of my friends went for waxing. As she was in waxing, the waxing went wrong.
How? What happened?
They waxed her. Nebatwala akanyama. Because while she went for waxing, she was doing shaving and she was getting bumps. Do you know the bumps? And those bumps were creating pus.
Okay.
So that now she decided to go for waxing. And again, the waxing brought problems to her. So now, doctor, what's your advice about waxing and shaving with that part? Because that part is a bit tricky.
Okay.
We get bumps with their normal shaving.
So there are people who have a sensitive skin. They are there. There are people when they completely remove hair. You see, the hair has got a specific way it grows. Even on the head, there's hair that grows growing downwards. Then there's hair that grows growing frontwards. When you cut hair on the opposite direction from the way it's growing, the one that is coming from down is going to be affected from how it's supposed to come out of the skin. And that can affect that hair that it even fails to come out and get strapped.
That's why we get the bumps.
Not every infection is bacteria.
Everyone.
You wanna make tasty food and sales. You wanna do that dancing still. Come down in one no ya night. Seek the buto one night. Nairo agro ya singa. Seek the buto one night. Can down in one no ya night. Seek the buto one night. Can down in one no ya night.
N'okusingawo tunda bulungi n'okusingawo ng'okozesa butto wa modern alimu ekiriisa ate nga taliimu masavu awamu n'engano etakwatira ku ngalo. Modern yennyabo bifune kati mu maduuka wonna mu ggwanga.
By the way, what is your name?
My name is Bosco.
Yeah.
Shivara.
Ngagobine enkoko. Aina katungulu, aina n'akambi.
Basenga wabayitote.
Bikini mama demo. Ela kadebe katu ne bakamba bikini mama demo. Yafunyiga demo come over.
These are the cases that I usually want to attend to, but they don't usually come in my office.
Nayi kidoke.
Lwaki oli mungatemu?
Wemba ngenda okuduka bwenti okusinziira. Yempa gia n'ensinziira bwenti.
Putulu. Okwita putulu. Bwemira fo. Gwoba oliko yenna. Bamukujjako mufu.
oyaba awedde
okuddukako olinamu ne giya
twetaagamuko ku mani power ngezanga amagi
amavumbe bulaba bekalakasa bayingiremu wakati tekawo obuko ogubalagala baveewo kino kyenkoze nange neesiba baaba you do as you wish please
and branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Jeanette Umar Kasule, a member from the Elite Little Hijabis. We are proud of our religion Islam and we believe in decency. I believe we can secure the next generation through the Little Hijabis. Registration is ongoing. Please, our dear parents, bring your children and sign them in for the Little Hijabis. Don't make them miss this one chance that they will have in their entire life. And training will start on 20th of July.
We understand how overwhelming life can get, and that's exactly why we created the Golden Living app. Getting started is simple. Just download the app, create your account, and unlock a world of healthcare at your fingertips. The Golden Living app is your personalized healthcare companion, designed to bring care closer to you, wherever you are, whenever you need it. With just a few taps, you can book doctor appointments without the hassle of phone calls or long queues. Need your medicine? Order it directly through the app. Quick, convenient, and delivered with care, straight from your phone, and even receive your lab results in the palm of your hand. And when it's time for imaging tests like x-rays or ultrasounds, you can schedule them seamlessly right from your phone. Want to monitor your well-being? The app also keeps all your medical records safe and accessible, so you can track your health history anytime, anywhere. And when you need advice, our 24/7 healthcare support is right there. Trusted professionals just a tap away. But the Golden Living app goes even further. Need urgent help? Our quick emergency feature connects you to support in minutes. One of our most thoughtful features is the Peer Reminder. Free, simple, and easy to set up. It helps you stay consistent with your treatment and ensures you never miss a dose. And it's not just for you. You can also support family and friends, especially loved ones who may need a little extra help remembering. Because caring for your health also means caring for theirs. The Golden Living app was built to make healthcare simple, accessible, and reliable. It's about giving you peace of mind, saving you time, and making sure your health always comes first. Download the Golden Living app today. Available on both Google Play and the App Store, and discover a new level of healthcare convenience. With the Golden Living app, every second counts.
Uganda muwulire ekitabangawo nuclear process ekutuusaako Irene Namatovu atuuse mu Kampala ku Serena Hotel ng'abiri mu August mu show gy'atuumye Strong Woman live okuyingira emitwalo 10 yeebye emitwalo 15 ku gate ate badde emitwalo 10 ate mmeeza ya milioni 3 ticket zitundibwa ku Papa Sport ku John Color Solutions ne ku Serena Hotel wennyene Irene Namatovu yasinga mu kyabayita authentic Ugandan rhythms enkuba ya Afro pop egatta engoma ya wano n'ekidongo ono ya Afrima Award winner best female artist mu East Africa choreography ya Irene Namatovu screen stage n'amataala abiri mu August Serena Hotel mwana watu nabo muwerekeddeko fogo kalempiza bimami bijje be strong woman ebikoze sente z'ekikazi twagala byana byeskoba bimadulo
kiwoza sente ziwawereza ku simu zabaddemu ekicupuli ky'etaano wereza endala
biwagidwa Uniform Pepsi Geneva Logistics Afro Mobile ne Sanyuka TV.
Diggy 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 da 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 diggy da. Ona baku dance floor come take it. Diggy 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 da 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 diggy da. Pick a biggie boy come pepeta. It's a girl Karakasita, Mama Sita at King Mama and one local executive media on the RealTime show with the girl Mini. Don't touch the dial. Maximum to the world.
Tuliku TMR Golden Living Specialized Clinics wano enalia ndiwone Dr. Eladu Dr. wa Fertility gynecologist nange ndi wano gynecologist wamwe yeah I'm a gyno by
proxy. Have you seen people who go to the US never find a PhD?
Muchi.
You've not seen ministers who go and then they give them PhDs after 2 weeks?
Why? How?
Hey.
Like
hey. So because so you've been discussing for some time,
I can get a PhD.
Or gynecologist.
Chewed.
Just don't go and cut people.
Yeah, you cannot because there I cannot exceed. I cannot exceed that. But at least now someone can talk to me and I know what's the problem. Before I send them to you, I can at least advise.
Can even tell them
the first aid can be given to them.
What
I can
you did
talk
was
to
wrong.
them. I tell them, no, that is not right. Should go and see a doctor. Please don't be scared.
And you see, that's
not worrying.
That is how it's supposed to be. Actually, we doctors, we are supposed to do more preventive medicine than curative medicine.
Yeah.
We are supposed to educate people.
Yes.
We are supposed to teach people. We are supposed to, so that by the time someone falls sick, they are doing the right things. You get it? Unfortunately, many times, or we find ourselves doing more treatment than actually preventing.
Yeah,
so me, I am very happy.
To talk to doctors.
I'm very happy when Zubeda, you are more knowledgeable. I think for the times that we have interacted.
Yeah.
What will change?
A very big change, because now I can talk to women. They come to me with their problems. I talk to them before I send them to you here. First talk to them. Tell them that is not worrying. Be calm. You're going to be treated. That is treatable. So, doctor, how are you? Hey, you're a very smart doctor.
I try.
Because today I see colors. Yeah.
Thank you. Thank you so much.
Who is your fashionista? You're the one. You don't have a designer.
Be a fashion. I don't even have a designer.
Hey, you design yourself.
Hey,
but that's good. You have a credit already on the designs.
Thank you.
Yes. So, doctor, as usual.
Yes.
Now, today I wanted us to talk about the discharge.
Okay.
Yeah, with the vaginal discharge. Now there is the white discharge, then the normal one. Then there is the yellowish one. Then there is that one which looks like spoiled milk. Which discharge can make me worry or go to the hospital? Because sometimes women, we get discharge, but when it's not itching, there is no pain, but I see a discharge. Whenever I remove my knicker, I see discharge. Mostly that one, which looks like spoiled milk. So is it a sign of infection or it's a sign of cancer? Because when we go to Google,
Google will
and
tell
you
you.
put in that I have a discharge, it has taken this long, they'll give you that is a sign of cervical cancer. You can go and check.
Now, all women have discharges. And this discharge can be produced from along the system, the reproductive system of a child. For example, there are glands around the vagina that produce a mucus discharge. Okay? And this mucus discharge helps especially during lubrication.
Okay.
During intercourse. Okay? So it's mucus discharge. There is another discharge, or the glands that are in the uterus. They also produce a fluid, or you find that fluid is either in the uterus or sometimes it's even around the cervix. The key statement is that most discharges should be like mucus, clear discharges. Okay? Now, the mucus can be thick during
clear.
When you're nearing ovulation, that the mucus becomes watery. Okay? Because at that point, the sperms and kwaso zomwame have to pass through and reach the egg. So if the mucus is very thick, it will not penetrate, or it will get trapped there. So the mucus becomes watery. Then after it becomes, so you notice that from the beginning of someone has had bleeding, of course, it becomes clear from bloody, then clear pinkish, then you get a clear discharge. Then near ovulation, it becomes watery. Then after ovulation, it becomes thick. Okay, then it keeps on repeating itself. Number two is that the vagina has got good and bad bacteria. Okay, the good bacteria help to control population of bad bacteria. All right, it's like the good bacteria act like policemen. So that if the bad bacteria starts to grow, they arrest the bad bacteria and keeping that place safe. The good bacteria also produces acids to keep the vagina acidic, so that the environment in the vagina is acidic. All right? That acidity is very helpful. It helps one keep you healthy. That's why we tell women, don't put things inside. Don't put soaps, don't put scents and all that. Because
we put garlic.
Why?
Infection.
Ate.
Treating the infection naturally. Without going to the hospital.
The hospitals are
we pierce the garlic, then we put it inside.
Do you know garlic is better even eaten than in that format? Because when you pierce, you're putting bacteria and all that, and then you're going to disorganize this ecosystem of the vagina.
It is not good.
The vagina should not receive anything.
You give us pessaries.
No, the pessaries are medications. We only give you pessaries when there is a problem. We don't just walk and say, Goli no mokale kwata pessary.
Doctor, a lot of women use garlic. They use garlic.
Do they want kawowo?
No, they are treating infection. With garlic, they are treating infection.
So, anyway, some of the things we're talking, these are really proven and conventions. But I also know that there are many people who are desperate for solutions. And some people may not have access to hospital. There are people who fear to spend, you get it, and all that. But even the government hospitals, that should be able to do these things for free. So the discharge spectrum keeps changing along the days of the menstrual cycle. But one thing it should not have a foul smell.
The fish smell.
So foul could be something bad, something is rotten, something that is like fish. Okay? Any smell that you yourself gets uncomfortable means there is a problem. Number two, the color should not change. When you start seeing yellow, creamish, greenish, whitish, spoiled milk, just know there is a problem.
There I need to see a doctor.
Then there you need to seek for help. Because when that discharge changes color, then now we need to know what is causing it to change color. The problem is when someone mentions infection, buli omu alowooza you're treating bacteria. Not every infection is bacteria.
Everyone thinks you're overdoing sex. That's why nowadays we don't say that we have infection. The doctors, you people are not good. You spoiled the word.
No, we did
because
not.
Now everyone who sees a woman with a cannula,
By the way, let
and
me
we
tell
say we
you,
have an infection.
not every infection is sexually transmitted. Some infections are hygiene issues. People who work in downtown, you share toilets. There are people who have very bad toilet habits. There are those ones who stand on the toilets.
Yes.
There are those who urinate on the surface of the toilets. There are those who don't even flush. Get it? So all these habits affect the hygiene. There are bathrooms that people take long to scrub. And the place is just dirty. You look at the sink and the place is dirty. As long as you allow the environment to be unhealthy, it is going to come back to you. And guess what? You sit in these toilets. You get in contact with the surfaces. These bacteria, you see, for women, and the other thing is that when we say infection, not every infection is a urinary infection. Not every infection is a UTI. The urinary system, the vaginal systems, are near each other. The urinary system connects from outside, it connects to the bladder. Then it connects to the kidneys. Vaginal system from the outside connects to the vagina, then connects to the uterus, then connects to the tubes. You've seen that drawing before. I've done it. I've showed you many times.
Yeah, I know it in my head, but these ones I don't know.
Maybe the
whether they
producer will show that
you,
picture.
You
So,
do you still have the picture? Yes.
So they will see, but these are two different systems. So not every infection is a UTI. The symptoms will tell us where this infection is primarily coming from. For example, if you're feeling pain in gofuka, you're feeling burning, you're urinating all the time, you urinate and you feel like the urine is not coming out completely, okay? You're feeling stomach pain, you're feeling pain on the back, then most likely you have a urinary problem. So then that is when the urinary test is necessary. Now, when discharge, the discharge is from the vaginal area.
Yes.
The discharge is causing you to have itching. The discharge is smelling badly. It's very unlikely that is primarily a problem of the urinary system. That is a problem of the reproductive system. And the test that has to be done is in concern with that discharge. Kubanga, we need to know what is causing this discharge to be abnormal. Is it bacteria? Is it fungal or candida? Is it protozoal infections? Could it be viruses? The only way is by examining that discharge.
So, doctor, what if I have the discharge and again I have pain?
So,
up here, down. What's that?
And now, remember, there are two systems that are near each other. Much as, so a problem in the vaginal system can easily find its way in the urinary system, and vice versa. A urinary infection can cause an infection in the vaginal system. So one, the doctor must talk to you and find out what exactly is the primary problem. Number two, the doctor must examine you.
They check the urine.
So either examine the stomach and see, are you feeling pain there? Are you feeling pain on the back? You get it. If you're saying you have a discharge, the doctor must examine the discharge. Kubanga, there are discharges that you can see no manyanti. This discharge is for a specific disease. This whitish discharge is for candida.
After checking,
after examining, then that sometimes may not be enough. The doctor must take off that sample. What is causing, so that the doctor gives you the right treatment. So our biggest problem as a country, as a people, is that tetwagala genda mu ddwaliro.
Anti ebintu ayigo bijjanjaba doctor.
And number two, because you used the pessaries last time, you think that the pessaries will solve every infection, even the ones that the pessaries cannot, because pessaries are mostly, most pessaries have antifungal properties. Kitegeza bijanjaba ebizwi nga candida and all that. So if you have a UTI,
it will
not, but you'll be using the pessary naye nga tewali njawulo.
Self-treatment with women. It is everywhere.
Now, for me, who is interested in fertility, I will tell you that over time, if you don't treat that infection properly, it's going to affect your fertility.
Oh.
Because that infection is going to climb waguru nechituka ku seke tubes, and then the tubes get blocked. Then you're 24, 25 years of age, you can't get pregnant.
So, doctor, some women also feel cramps.
Yes.
Not for periods, but after the periods, she's okay. She sees the discharge, pain, abdominal pain, then cramps.
So the question
is, real cramps.
One, there are structures that can cause you to have crampy-like pains. The uterus is number one.
Why?
Because the uterus has got muscles that contract.
Oh. There is no problem.
There is no problem. Okay. But if at all you have a problem in the uterus, it can also cause cramps. It can also contract. If there's an infection that has climbed from the vagina paka munabana, it can cause cramps. But number two, the tubes can also cause cramps because they're near the uterus. Number three, the ureters, the ones which collect urine from the kidney, can, because when urine moves in waves along the ureters. So those wave-like movements can actually cause cramps. For example, if someone has got a stone, what we call a urinary stone, can cause cramps or can cause crampy-like pains. So it doesn't mean that that people only get cramps during periods, no. But then it goes back to what other symptoms does the patient have? What examination can the doctor do? What tests can the doctor do? So that you are treated properly. The only key message I'm telling people, if you have an abnormal discharge, let us find out what exactly is causing this discharge to janjabe bulungi, and you can cure.
But doctor, sometimes we go to hospitals. They take your urine, they do blood samples, but again they say you do not have any infection, yet you have a discharge.
Do they take off the discharge?
They don't. Most of the hospitals don't do that. Because they just do urine tests and blood. Then they say you don't have any infection.
So now me, I want to empower whoever is listening and watching us. Or in an infection, be confident. Tell the doctor, ninawo discharge. It is the one which is disturbing, and this discharge is not normal, doesn't smell well, and I want treatment for it. And that doctor should be able to suggest to take off that discharge. If he's not comfortable, then go to a place where they're comfortable to take off that discharge. And the reason why could be maybe people, they don't have the resources to
do the test.
Yes, to do the test. They cannot do maybe a culture and sensitivity. They don't have a microscope, so it's easy for them to just ask for a urine test.
Then they tell you do not have any infections.
And yet you have a discharge which is not normal. So that discharge should be examined. Sometimes I get patients and I tell them, are you okay for us to take off this discharge? Just treat me. But then you tell them it's not right because I don't know what I'm treating. We are not witch doctors that. So the women, and I know sometimes it's not comfortable. Someone is telling you, do this, and even if you're not comfortable,
you're not giving birth.
Even if you're not comfortable, there are nurses who can do that. So if you're not comfortable, the doctor taking off a sample, at least the doctor will suggest it. Nurse, I can instruct the nurse and tell them, get that sample. Kubanga, we want to treat you.
So doctor, is it normal for us who do steaming? We pay for steaming and we pay very good money. Then if we don't pay for them, we do it at home. For over 30 minutes, we are steaming.
What is the objective of the steaming? What do you want to achieve with steaming?
We treat infections, bad smell, mostly those. But after periods, we want to treat the infections. Remember, when we get infections after and before, so we treat them by steaming. We even go there and read novels when we are steaming for over an hour. You're steaming.
Professor Zubeda. If you have a bacteria, that steam will not kill that bacteria. It will not. It will not. If you have the fungi, now those ones are even difficult. They don't die easily. If you are candida, you steam and then candida will not disappear.
It won't.
You may even find the steam may be helping the candida because candida likes moist surfaces. Those fungal infections.
Why don't you tell us that we are not supposed to steam when we come to the hospital?
Zubeda, we speak, but people don't listen. We speak, people don't listen. But also, we know there are people who have nicer words out there. There are people who will tell. Recently, I saw someone on, I don't know where, they were telling people who have fibroids, ina fibroids. I saw. Then I'm like, but do you know how someone can be dealing with pain when they have fibroids, when they're having heavy bleeding when they have fibroids? But because you don't want to have surgery, when you listen to such a person, you're going to believe us. You get it? So yes, there is a lot of work for us doctors to do to really educate you people, to teach you people, but you should also be willing to learn.
We are big-headed. And women, we are big-headed.
You should be willing to learn. But also, it's your health. How you treat it is how it's going to turn out.
So, doctor, does hydration, like taking water, can it help me with the infections, recurring infections?
Very, very much. Hydration, very, very much. So one, the hydration helps you to flush out the bacteria. If the bacterial load is low, then treatment can be achieved quicker.
So it is okay, I can even leave the hospital.
No, but
not come for treatment, but I take water.
But see, hydrate,
so that
hydrate. That is before you get the infection. But hydrate. We talk about hydration. But when the infection is there, and you know that you have the symptoms of infection, go and seek help. On top of hydrating, get the necessary treatment. Okay. It will help. Hydration is it's what your body uses for recovery, for repairing. When the infections destroy cells. So for cells to heal, they need water. So that hydration doesn't just help flush out the infection, helps with healing, helps with lubrication, helps with forming the normal discharge. You get it?
So, Dr. Kanonga kagenda banyiza. But does cloves heal infections?
Cloves contain...
When I put them in water, I leave them for days, then I use it.
But you see, most of these things we eat, they contain medicinal properties. You get it? That it shouldn't, if you have a problem, let us not fear to go to hospital to get the treatment. Because the drugs we give you, we got them from some of these things, but refined them to the right dose so that it can help clear the
Doctor, but as you've said earlier, that sometimes we want to do self-treatment, sometimes we don't have money. So people say cloves treat infections. And again, others say it can cause infertility.
No, cloves don't cause infertility. They don't. I have not come across an article or a publication that points to cloves. No, I haven't. Yeah, but are they helpful? With the immunity, yes, they can help boost your immunity. They can help, they can help your body to fight off these infections and all that. But cloves may not replace the drugs. You can take the drugs and then, yes. No. I told you, a hospital is not, let's not fear hospitals, bed.
And the doctor, you leave TMR where you come and you don't see injections, you don't hear any smell of tablets and everything. But you go to hospitals and you see people crying here, there, someone is dead there, the other one is bleeding. They tell you, oh, you have food infection. I almost died. And it is my friend who told me. I called my friend and she said, you use garlic. I almost collapsed. It burns.
Now you're even lucky. I've seen people who use things like soda, omo, and they don't.
But
And they don't just use it for infections. They even use it to prevent pregnancy. They get omo, mix. Never you are munda.
Kapia, that's new to me. I've never heard of it.
Naye nawe towulira
Me, I used it before I came to this lecture. Before I started the lecture. Yes. Me, I can no longer do self-treatment.
If I hear oliku garlic.
Garlic almost killed me one day, doctor. You're still on garlic. There are some local medicine that can even burn you and you die.
And actually, some of those things are the ones that give us this recurrent. Because you see, if you destroy the environment of the vagina, because that environment is so delicate, if you destroy it by introducing these things, it will take you longer for that environment to repair itself. And it will put you at risk of having recurrent discharges and infections and all that because of one mistake that you did or because of the recurrent things that you're pushing there.
So, doctor, as we are winding up, now, there is, we do waxing and normal shaving.
Yes.
Now, one of my friends went for waxing. As she was in waxing, the waxing went wrong.
How? What happened?
They waxed her, nebatwala akanyama. Because while she went for waxing, she was doing shaving and she was getting bumps. Do you know the bumps? And those bumps were creating pus.
Okay.
So that now she decided to go for waxing. And again, the waxing brought problems to her. So now, doctor, what's your advice about waxing and shaving with that part? Because that part is a bit tricky.
Okay.
We get bumps with their normal shaving.
So there are people who have a sensitive skin. They are there. There are people when they completely remove hair. You see, the hair has got a specific way it grows. Even on the head, there is hair that grows growing downwards. Then there's hair that grows growing frontwards. When you cut hair on the opposite direction from the way it's growing, the one that is coming from down is going to be affected from how it's supposed to come out of the skin. And that can affect that hair that it even fails to come out and gets trapped.
That's why we get the bumps.
So when that hair follicle gets trapped, it cannot grow properly. The oil that was around that hair gets trapped there. Bacteria fill in that hair follicle. Nofuna bumps. Nemuvamu pus because bacteria has entered there. Pus is because there is bacteria. So usually the advice that we give and the skin specialists give is that if you are someone who has a sensitive skin, do not cut hair completely up to zero. Leave a very small inch of hair on the surface because that allows that hair to continue growing on that way it was growing. But if you clear it completely, paka 1C, then when that hair is coming back, it's going to be affected depending on how you cut it. So that's usually the best advice we give people who have a sensitive skin. Okay? Now, waxing is good for people who can endure. And also if
endure the pain.
You can endure the pain.
Because
but also people who
it can go wrong.
Yes, it can go wrong. And go to places where people are trained. There are people who feel joy when you are in pain. They're like, this has gone well. Now, if it comes out with the kanyam, you cannot go back. You cannot recover from that. You get it.
Has never recovered.
And some people have very bad skins. They form scars and all that around that place. You get it. So it's very important that you identify. There are people who use shavers and they don't find any problem.
Yes, there are those who use them and get bumps.
So now such people, you should know your type of skin. You should know how best to deal with it.
So if that skin is full of bumps, can you help that woman?
Yeah.
Everywhere there are bumps.
No,
around the skin. She can't
tubes.
even look at herself. And she come for surgery.
Not surgery. Not everything is surgery, but there are tubes that we can give such a person to help them heal.
Oh.
You get it? It's not plastic surgery. Dr. Martin cannot.
Dr. Martin can treat them. Oh. It is okay. Me, I was asking for women. You know, women have a lot of problems. Mostly we want to take care of that place.
Yeah.
We think more of it. But sometimes we get problems. Baba na kanyama doctor bambi. You say sorry to her.
We are very sorry.
So mkwano gwange doctor mukubuuliza ekibuuzo. It is okay now. You don't shave the whole place. Don't go back to waxing, but don't shave.
Don't cut completely down. Leave a small inch.
Yes.
Eh?
Don't be bold.
Don't go bold. I do not. Maybe I know some people really, but you don't have to go really bold. You can look decent without being bold.
Karim, doctor, you say goodbye to my friend and everyone on Executive Media.
Thank you very much for hosting me, and yeah, we will get you on the next one.
Yes. Yeah, doctor, you know I love you so much. I'm a very good student.
You are?
Yeah.
You're a good student. Now don't go back to garlic.
Garlic almost killed me. I cannot go back. I got burnt. So, musibe bulungi mweraba.
Executive Media. Focus, innovate, succeed.